health includes emotional, psychological, and social well-being. It impacts how we think, feel, and how we respond to different circumstances. So our goal here is to really care for the whole person and really care about mental health in totality. At Riverside Behavioral Health Center, we have several different treatment options for adults.
So we deal with patients who come here for a variety of reasons. We definitely have a large group of folks who come in voluntarily. They recognize that they're running into a problem and they need some help kind of clarifying things, setting some goals for themselves, reconnecting with others. And we have folks who, for whatever reason, have to come in and stay for a while for their own safety, for the safety of others. We can help them gain some clarity to their situation, whether that be reality orientation for the patient for a few days, providing some basic human needs to them that they may not have been getting while they were out in society.
We also provide services for adolescents aged 12 through 18. This is on the inpatient side. So again, it's that highest level of care. It's that really intensive inpatient treatment where individuals meet with doctors or psychiatric mental health nurse practitioners, as well as psychiatric therapists, as well as nurses, of course, around the clock to help support their needs during that really critical time.
For a caregiver or for a parent to get their child to come to Riverside, the biggest thing is to sit down and to talk to them. To talk to them about the emotions that they're experiencing. If they feel like they want to hurt themselves or want to hurt somebody else, if you notice that they're journaling about things that seem to be darker, or if they're drawing kind of dark pictures, talk to them about that. Tell them, hey, maybe we need to go to the hospital to talk to a psychiatrist there or a therapist there, and maybe even start medication to get the help that you need so we can get these emotions and kind of things that you're feeling to calm down some.
At RBHC, we really focus on providing individualized and holistic care. If a patient's admitted to our facility or one of our programs and is struggling with both substance use and mental illness, then we have the team really structured to meet those individualized needs.
So the addictions programs that we have here are for adults, treat adolescents with addiction on an outpatient side. So we have 2 programs, generally lasting a few weeks at a time, where people go through groups. They can also see a medication provider as well, because of course with addiction sometimes there are other mental health issues that go along with it, and sometimes those things need to be treated as well. But those programs are for people who are addicted to any substance. So it can be alcohol, it can be marijuana, it can be cocaine. And if they come here, we can kind of screen everybody or screen that person to see if going straight to that addiction program is the right thing for them, or if we need to admit them to the inpatient unit first to detox and then transfer them to that program.
Crisis services here at Riverside Behavioral Health Center is inpatient psychiatric care, mental health treatment for both adolescents and adults. We also provide outpatient substance abuse treatment. We do partial day treatment as well as intensive outpatient.
Riverside has 3 new outpatient programs that are being developed. They are 3 different levels of care. One is the PHP program, which is our partial hospitalization program. Then we have our IOP program, which is our intensive outpatient program. And then we have our regular outpatient program. All of the programs will offer certain levels of care. They will offer individual therapy, individual treatment plans, group therapy, family therapy, access to a psychiatric provider, a nurse, and a peer recovery specialist.
Riverside is opening a very unique specialty emergency department in 2023. The purpose of this emergency department is for psychiatric services and substance abuse disorders. So patients, which could be adolescent patients or adult patients, now have an opportunity to come to a specialty emergency department where their primary issue is a psychiatric issue, or any patients in crisis or requesting or looking for any help related to substance use disorders. We know that this is a very special patient population that needs additional services beyond what a traditional medical emergency department can offer. We are very, very confident and very comfortable in the care we're going to provide, and this is truly the first of its kind in the state of Virginia.
If you need help, come and get help. We will try to do whatever we can to help you.